I would like to find out first and foremost, what is a nurse practitioner?
That's a good question. Many questions.
Sorry, I didn't interrupt.
Oh, that's good.
I've run myself through a godsend.
Thank you. I'm happy to hear that. So school-wise, we are nurses who did our degree, and after that went to do a master degree with a certificate as a nurse practitioner. And basically our scope of practice is a bit more extended than a regular registered nurse. So we are allowed to prescribe medication, order blood work, but we are also able to do a much more deeper health assessment of our patient. So that's what we do, and we work in collaboration with physician. And we are mostly in primary health care, but you would find nurse practitioner in hospitals as well, emergency department, long-term care, palliative settings. So we are a bit everywhere in the province of Ontario.
My impression, one of the biggest impressions I have of nurse practitioner, just to make a fine point, is that your area of responsibilities, your area of expertise, absolutely helps sort of alleviate the load on the doctor's shoulders. Is that a fair statement?
Well, we do work in collaboration with physicians, definitely, and I think that's how we offload, you know, the practice and everything. But it's really, we do a head-to-toe assessment, we do a biopsychosocial assessment, so we don't forget the family, we don't forget the community,
Right.
And we work in collaboration with a physician that sometimes don't have a half an hour to spend. So working with us, we get a chance to do that. We talk about the patient together, and it's a true collaboration. I think it's a great way of practicing.
What is the vision of the Ministry of Health here in Ontario?
Well, I think there's some changes that happen. They're really focusing now on patient first, and you can see that online. There's some documents on the Ministry of Health about the patient first initiative, which is really to put the patient back at the center of the care. And basically there is some initiatives starting to bloom around Ontario to really address the needs of the patient. But the main goal is really trying to keep the patient out of the hospitals, keeping them more in the community, supporting the family to take care of the patient. So we're moving back into the community. I think it was a tendency maybe 60, 70 years ago. We had a lot of home visits, which basically that went away. We went back to clinics and hospital settings,
Right.
And now we're starting to go back into
the homes.
Yeah.
Now let me.
So the program we created, which is in line with the Ministry of Health, came from the LIM, which is the sub level of the Ministry of Health. Then you have the health links that were created. So we work in collaboration with health links, the Quinty health links. That was a leadership in that aspect to start to do coordinated care plans. So the Prince Edward County Family Health Team here, we decided to create a collaborative care plan just because we wanted to enhance a collaboration. But it's in that philosophy to really put care around the patient, identify those patients who are more at risk, frail, elderly with multiple comorbidities, multiple disease, social needs at times, and how can we support them within the community to make them better or to get where they need to go. The important thing in that it's always a patient-centered aspect, and to really realize what are the patient goals. And you know, we tend to forget sometimes, well, let's do this, do that in the medical world to make them better, when we forget to ask truly the patient, what do you want, what do you need, and ask the family about that and work around them basically. So I think it's a bit of a shift there that we're trying to address as well.